You're very welcome to this talk. Now, I want to listen to some testimony from Brad Wenstrup, Dr. Brad Wenstrup, who is the chair of the House of Representatives Committee on Oversight, himself a doctor and a part-time military colonel. These hearings took place on the 3rd of June, and they're entitled A Hearing with Dr. Anthony Fauci, former director, National Institutes of Allergy and Infectious Diseases. And it really is quite stunning stuff. And I know a lot of you have been reading this book here by Robert Kennedy Jr., The Real Anthony Fauci, Bill Gates, Big Pharma, and the Global War on Democracy and Public Health. The level of scholarship in this book is quite extraordinary. Absolutely quite an incredible document. And the thing is, I don't think, although there's some things that in this book that are hard to read, as far as I know, there's been no litigation in the United States against the content of this book, as far as I'm aware. Standing in the centre of all the mayhem, with his confident hand on the helm, was one dominating figure. As the trusted public face of the United States government response to COVID-19, Dr. Anthony Fauci set his perilous course and sold the American public on a new destination for our democracy. But anyway, I'm not sure what I can read you from this, but it really is quite an incredible document. Get it from the library or lend it from a mate. Anyway, let's listen to Dr. Wenstrup now.
We are following the facts, holding wrongdoers accountable, and planning for a better, more prepared future. Beginning early in 2020, you became the figurehead of public health. There were drinks named after you, you got bobbleheads made in your likeness, you were on the cover of Vogue, throughout the first pitch at a Washington Nationals game. Almost overnight, you became a celebrity and a household name, in addition to being a public health official. Americans from coast to coast and beyond listened to your words, and this is where I think we could have done better. And this goes to both sides of the aisle. We should have been more precise. We should have used words and phrases that are accurate and not misleading. And we should have been honest, especially about what we didn't know. Dr. Fauci, I'm not a virologist, but I am a physician, and like most physicians, we are constantly learning, which is why we do continuing medical education, and we always seek new information. We learn new things based on new data, and we want to give our patients the best possible care based on new findings and improvements in science. At a time when you were prompting the proximal origin paper, whose focus was to, quote, disprove the lab leak theory, end quote, I was in lockdown, researching with another physician in Ohio to try and understand the pathology, the affected physiology, and what treatments worked, and even how to diagnose COVID before we had specific COVID tests. My friend even made a phone call to an infectious disease doctor in China looking for help. As well, during that time, we discovered the Barrick-Shih 2015 article on creating a chimera using gain-of-function type technology. While policy decisions should have been based on scientific data, some frankly were not. The burdensome 6-foot social distancing rule did not have sufficient scientific report. In your words, it just sort of appeared. Distancing made sense, but the 6 feet was arbitrary. Even Dr. Collins said he still hasn't seen any empirical evidence to support the 6-foot rule. A rule that shut down schools and businesses, a rule that will have negative ramifications for decades. As the pandemic wore on, more mandates also just sort of appeared. But the American public didn't get to see the scientific data to support these mandates. Americans were aggressively bullied, shamed, and silenced for merely questioning or debating issues such as social distancing, masks, vaccines, or the origins of COVID. Many Americans were willing to comply with the 15 days to slow the spread and understood the necessity of banning travel from certain countries in an attempt to slow down the virus. But many Americans became very frustrated when components of those 15 days stretched into years. And it should not have been the case that Americans were forced to comply with oppressive mandates when those who chose to illegally cross our southern border were not. Or when Governor Newsom or Governor Whitmer were throwing parties at nice restaurants. Not a good look. Americans do not hate science, but Americans know hypocrisy when they see it. Dr. Fauci, under your leadership, the United States health agencies adopted specific policy aims as a single dogmatic truth, without the benefit of debate, out of a desire for a single narrative. Dr. Fauci, you once said, if you disagree with me, you disagree with science. Science doesn't belong to any one person. I was never taught that science turns a blind eye to hypotheses. They serve to be proven or disproven, and done so with irrefutable facts, if able. It was interesting that you chose not to pursue an aggressive and transparent scientific investigation of both natural spillover and lab leak. We have been investigating both hypotheses. You testified before the Select Subcommittee in your transcribed interview that the lab leak theory was not a conspiracy theory. You embraced the proximal origin letter. It wasn't necessarily a full peer-reviewed research paper, but you embraced proximal origin letter and you shared it with the public from the White House lawn. You stated during your transcribed interview that you did not review published articles that considered a potential lab leak of COVID-19. This is especially concerning if the works in question were conducted at a more risky and less safe BSL-2 lab. Nevertheless, any dissent from your chosen scientific position was immediately labeled as anti-science. Anything less than complete submission to the mandates could cost you your livelihood, your ability to go into public, your child's ability to attend school. Families were thrown off planes and shamed when their 2-year-olds struggled to wear a mask. Children with disabilities lost access to therapy that they and their families depended on. Students were out of the classroom and told to attend school remotely, even when the science clearly demonstrated it was safe for them to go back in the classroom. This harmed low-income students the most. And how were single-parent households supposed to teach their own children and work at the same time? Dr. Fauci, you oversaw one of the most invasive regimes of domestic policy the U.S. has ever seen, including mask mandates, school closures, coerced vaccination, social distancing of 6 feet, and more. We've learned many lessons. Our early fear and confusion was understandable. COVID-19 was clearly a novel virus. Under your leadership, NIAID allowed disgraced characters like Dr. Peter Daszak to use millions in taxpayer dollars to conduct risky gain-of-function experiments in Wuhan, China. The actions of EcoHealth and Dr. Daszak call into question the integrity of NIAID's policies and procedures as a whole, as well as your role, Dr. Fauci, as NIAID's director. You did sign off on his research grant. We need to know why Dr. David Morans, your direct report for more than 2 decades, assisted Dr. Daszak in avoiding oversight and scrutiny and said that you were involved. Your senior advisor and seemingly your chief of staff repeatedly attempted to evade transparency laws to shield information from public scrutiny. We have senior officials from your office in their own writing discussing breaking federal law, deleting official records, and sharing private government information with grant recipients. The office you directed and those serving under your leadership chose to flout the law and bragged about it. Why did you allow your office to be unaccountable to the American people? You were the highest paid person in the government. This makes you more accountable to the people, not less. Dr. Fauci, whether intentional or not, you became so powerful that any disagreements the public had with you were forbidden and censored on social and most legacy media time and time again. This is why so many Americans became so angry, because this was fundamentally un-American. If I make a mistake, I answer to the people of Ohio who elected me and to my own conscience. When you and your agency made mistakes, Dr. Fauci, what happened? We all need to be held accountable. Sometimes it's as simple as saying, we were wrong. You took the position that you presented the science. Your words came across to so many people as final and as infallible in matters pertaining to the pandemic. But such rigid demands of an ideologically diverse people like Americans shattered public trust in American health institutions. Because I said so has never been good enough for Americans, and it never will be. It's built into the American spirit. We have a thirst for information, a drive for advancement. Americans were first in flight. We landed on the moon. We've cured diseases. You've been part of that. And we made innumerable discoveries and explorations that forever changed humanity. Americans do not want to be indoctrinated. They want to be educated. And they prefer to make their health decisions in conjunction with the doctor that they know and trust. To be successful, our federal public health institutions must be accountable to the people again. To be successful, our health organizations must do what they are supposed to do: protect Americans.
Well, I think you'll agree, pretty hard-hitting stuff there from Dr. Brad Wenstrup, chair of the House Representatives Committee on Oversight. I mean, it's hard to disagree with any of that, really. He wants to follow facts. He wants a better prepared future. He wants honesty about what we don't know. Please, some humility. There's lots of things we don't know. Let's be honest about that. He wants to aim for the best possible care, of course. He wants more scientific rationale because there's been a lack of scientific rationale. And this Origins paper we was talking about, I mean, that was published. And as far as I know, it's still in the public domain. And it basically said, if you think that the virus could have come from a lab, well, you're a conspiracy theorist. Pooh-poohed, dismissed. And of course, at least two American intelligence agencies now do think the COVID virus came from a lab. He talked about gain of function, risky gain of function research in China. The links between the American institutions and the Chinese institutions, flouting the law. And Dr. Fauci's high salary, according to Robert Kennedy in this book, $417,608 per year, which is quite a nice salary, of course. And some of the things in this book are really quite extraordinary that RFK talks about. I really don't know what I can read out to you. I mean, just a sentence here. I thought I knew everything about regulatory capture, and that I had armoured myself with an appropriate shield of cynicism. But I was wrong about that. And Robert Kennedy, of course, has got a high, long record of fighting various aspects of corruption. We have no way of knowing how many people died from isolation, unemployment, deferred medical care, depression, mental illness, obesity, stress, overdose, suicide, addiction, alcoholism, and the accidents that so often accompany despair. And it talks about the economic influences of the pandemic as well. I mean, for example, just one more thing I'll read from this book. In 2020, workers lost $3.7 trillion, while billionaires gained $3.9 trillion. I mean, what's $1 billion? And never mind $1 trillion. Some 493 individuals became new billionaires, and an additional 8 million Americans dropped below the poverty line. Quite incredible wealth transfer. Anyway, do check out that book for yourself. Well worth looking at. I was amazed how well referenced and researched this is. Every chapter is really, really well referenced. It's a very, very thorough piece of work. Now, I am looking at more from this inquiry, and we'll probably post some of that shortly. But for now, we'll leave that there for reflection. Really quite incredible, but good to hear Dr. Wenstrup just looking at that calmly, objectively and scientifically. That's what we want. Let's hope that lessons are indeed learnt, because quite a few of us have got a feeling that there's more issues to come. For now, thank you for watching.